The NHS, Britain's beloved but beleaguered healthcare system, is in trouble. That's the stark message from Labour leader Sir Keir Starmer. He's pointing the finger squarely at the Conservative Party, who have been in power for over a decade. Starmer argues that years of austerity measures and mismanagement have pushed the NHS to the brink. Broken is a strong word, but Starmer insists it's justified. He points to skyrocketing waiting times, with patients facing agonising delays for treatment. He highlights the plight of children whose health outcomes are worsening under the strain. And he warns of a demoralized workforce, exhausted and overwhelmed by the sheer scale of the crisis. The Conservatives, for their part, deny the NHS is broken. They point to record levels of funding and insist they're tackling the challenges. But with public satisfaction in the NHS at an all-time low, Starmer's message is clearly resonating. Could this be the issue that defines the next general election? Adding weight to Starmer's claims is a damning new report from healthcare expert Lord Darzi. Commissioned by the Labour Party, the report paints a bleak picture of the NHS's current state. It warns that the system is buckling under the pressure of an ageing population, rising demand, and chronic underfunding. The report's findings are stark. Waiting times for treatment are at their highest level since records began. The NHS is grappling with a staffing crisis, with tens of thousands of vacancies across key professions. And the COVID-19 pandemic has exacerbated existing problems, creating a huge backlog of cases and pushing staff to their limits. Lord Darzi doesn't mince his words. The NHS is at a tipping point. He warns that without urgent action, the system risks sliding into a state of permanent crisis. His report is a wake-up call, not just for the government, but for the entire nation. The question now is, will anyone listen? Sir Keir Starmer isn't just diagnosing the problem, he's proposing solutions. Labour, he says, has a plan to fix the NHS. Central to this plan is a massive injection of funding. Starmer pledges to recruit thousands of new doctors and nurses, tackling the staffing crisis head-on. But it's not just about throwing money at the problem, Starmer insists. Labour's plan also focuses on prevention. By investing in early intervention and public health measures, Starmer aims to reduce the number of people needing expensive hospital treatment in the first place. Labour's plan also includes a radical shake-up of how the NHS is run. This includes giving patients more control over their care and empowering frontline staff to make decisions. It's an ambitious vision, but one that Starmer believes is essential to save the NHS for future generations. Will it be enough to convince voters that Labour can be trusted with their healthcare? Section 4. A nation divided on healthcare. The NHS has long been a political football, and the debate over its future is as heated as ever. Labour accuses the Conservatives of running down the NHS and prioritising private healthcare over public provision. The Conservatives, in turn, accuse Labour of reckless spending promises and failing to grasp the complexities of healthcare management. Meanwhile, the public watches on with a mixture of anxiety and frustration. Everyone has a story about the NHS, whether it's a loved one facing a long wait for treatment or a positive experience with a dedicated nurse. The NHS is deeply personal, and the stakes in this debate couldn't be higher. The upcoming general election is shaping up to be a referendum on the NHS. Will voters trust Labour with their healthcare, or will they stick with the Conservatives? The answer to that question will have profound implications for the future of Britain's most cherished institution. Section 5. Can the NHS be healed? The NHS is at a crossroads. Years of underfunding, coupled with the unprecedented challenges of the COVID-19 pandemic, have pushed the system to its limits. The question now is, can it be saved? Sir Keir Starmer believes it can. He argues that with the right leadership and a clear plan, the NHS can be restored to its former glory. He promises a future where waiting times are a thing of the past, where patients receive the care they need when they need it, and where NHS staff feel valued and supported. It's a compelling vision, but one that faces significant challenges. The NHS is a vast and complex organisation, and turning it around will require more than just good intentions. It will require sustained investment, radical reform, and above all, the unwavering support of the British people. The future of the NHS hangs in the balance.